Oh, yeah.
Perfect. Felt okay? Good.
Yeah,
There we
I
go.
felt that one.
There it is. Woo! Perfect.
Uh,
All right. Doing good?
I'm fine. It's like the release.
Yeah. All right. So I was looking at your chart, and I saw you're having some low back issues, some stuff with your SI joint, and then a little bit in the neck. Is that right?
Yeah, always having lower back, when you stand long periods of time or
Yeah.
not wearing the proper shoes. So I feel it, down here.
Okay. Kind of that left side where your tailbone and your hip meet your
You
low
can
back.
probably, I don't know, measure my legs and see what's out of whack and stuff. But
Yeah.
if there's anything, and then whether I'm sleeping wrong, I use a real true foam pillow.
Mhm.
Love that thing.
Yeah.
Not a feather.
All right.
Can't do feather pillow. When I travel for work, it's like, oh, I hate these hotel pillows.
Just wake up feeling worse every time.
Yeah, oh, it's terrible. And then underneath my right shoulder blade or my left, I'm not sure. I lay on my side,
Yeah.
and then I'm on the couch, and like,
Mm-hmm.
so just basic growing old.
Yeah, just kind of stiffness and stuff.
Yeah.
Okay. So the low back and that kind of SI joint, does that feel more sharp, like someone's poking you, or is that more like dull and achy and tight?
At times it could be like someone's
Stabbing you.
stabbing me, and then most of the time it's dull.
Okay. Yeah.
But it's just annoying.
Okay.
You know,
And you're not having any numbness or tingling or anything going down your legs or anything like that?
No.
Okay. And then the neck, is that also more like dull, achy, tight, stiff, and the shoulder
It's
blades?
just like wear and tear.
Okay.
Tired. Not tired, but just like
Yeah.
I'm a self-popper,
Right.
which I know I've been told to stop. But
Well, I mean, do you feel worse when you pop yourself, or do you
it's
always
like
feel
a
better?
relief,
Yeah.
but then, do it to a point where, okay, it can't go any further.
Yeah.
But, always been a knuckle popper, which is so bad.
Generally, it's not that big of a deal, especially as long as nothing hurts afterwards.
Right.
Sometimes patients will come in and they pop their own neck or they pop their own back, and I'll ask them, do you ever feel worse when you do that? They're like, yeah, sometimes I feel like I make it much worse.
Like I've noticed that I haven't been able to pop my lower back, with a good old twist. I haven't
Yeah.
been able to do that as much lately.
Right.
I don't know if that's just age or my.
Maybe just be tight. Sometimes, especially when you start to get tight, you have a hard time doing that. One of the things that's different is patients will often say, oh, well, when I pop my own neck, I don't feel as good as when you pop it for me, right? And generally the idea behind that is that when you're able to pop something of your own kind of power, what you're often doing is you're moving a segment that is already moving fairly well next to a segment that feels stiff because it's stuck. And so what happens is the stiff area, we're kind of missing it when we're popping ourselves, so we get a little bit of relief, but not the same kind of relief. Whereas chiropractors, we go in and we find the most stuck joint or the stiffest joint, and then we pop that for you. And that helps to kind of normalize the motion in the whole area, and it reduces the stiffness.
Yeah, I avoided popping anything today, so you could.
Yeah, saved it for me. I appreciate it.
Have fun.
Okay. Well, I know you rated your pain relatively low, kind of like a 2 out of 10, so it's more so annoying.
It's when the lower back flares up, or if I'm standing or walking, I'm pretty good, but then when I sit down, I'm like, okay, I'm done standing. But I don't know if it's just genetics. My grandfather had a slight form of scoliosis, curvature of the spine.
Yeah.
My dad doesn't have it so much, but it's just always lingering. Could that happen to me one day?
Yeah.
So
Maybe a combination of what you're doing for work, just postures, repetitive tasks, and things like that. But, so you've been to a chiropractor before, right? Okay. How long has it been since you were last adjusted? A long time?
Probably 8 years.
8 years?
Yeah,
Okay.
ever since I had kids, I'd stuck.
Gotcha. Okay.
Not for financially, it's just I don't have time.
Yeah.
My kids are older,
Can't get a moment to yourself.
yeah, for
Yeah.
real.
Okay. Well, here's what we'll do. We'll keep it relatively simple today because it doesn't sound like anything's too crazy going on. So we'll just see how well you're moving. We'll check your spine out, see what needs to move. We'll adjust you where you need to be adjusted, and then we'll kind of see how you're feeling afterwards, okay?
Cool.
Let's do this. Go ahead and sit up tall for me. You're going to bring your chin down to your chest as far as you can. Okay? And then look up towards the ceiling back as far as you can. All right. Come back to the center. Look over your right shoulder as far as you can. And then over your left.
As far as I can.
Yeah. Okay, not too bad. We're not turning quite as well to the left as we are to the right, but the difference is minor. We're a little bit stiff coming down with the chin to the chest. Did you feel kind of like a pulling there when you came down?
Yeah, right.
At the base of the neck. Okay. And let's have you stand right here for me. You're going to face towards the door. You'll reach down and touch your toes as far as you can. Okay. And then come on back up. Bend backwards as far as you can.
Backwards.
Okay. Good. Don't be a hero. There you go. All right. So not too bad. Overall, you're moving pretty well. So let's see if we can figure out exactly why you feel so stiff. So let's have you go face down here. You might want to take the hat off. Yeah. Your face will go right here where the paper is. There's a little handle for you to grab onto right there where my foot is. Good. And then scoot down just a little bit more. Right there. All right. Comfortable? A little stiffness here through the ribs. Okay. Right there. When I press there, painful? Okay. Is that pain sharp or dull?
Sharp.
Sharp. Yeah. That hip is stuck. Okay. A little stiff here, not terrible. A little bit right there for sure. Yeah, so let's start here. So, I'm gonna have you turn your face to the left and then lay your head flat. Good, I'm gonna reposition you a little bit right there, okay? Let your shoulders relax as much as you can, let your head be loose. I'm gonna give you a little push here.
Yeah.
Perfect. Nice and easy for the first one. Okay, let's have you lay on your back now.
So you didn't want to do the other side?
Oh, we're gonna get the other side of your neck a little bit higher up. Okay. Yeah, okay. Nice and easy. Perfect. Felt okay? Good. All right. I'm gonna come up here a little bit higher on this right side as well. Good. Perfect. Okay. Off to a good start. Let's scoot you down a little bit now. Good. Right there is probably okay. Awesome. All right. So, I'm going to cross your arms here. Good. I'm going to roll you a little bit. Deep breath in. Out. Good. All the way out. Loose shoulders. Perfect. Awesome. And again, breathe in. Out. Good. Awesome. All right.
Yes.
Doing good?
I'm fine. It's like the release.
Yeah. It's like a weight falls off you.
A little bit.
Yeah. Okay. Now we're gonna hit that hip. This one might be a little bit spicy because I know it's kind of sensitive. So
Okay.
let's have you roll on your side. You're gonna face me over here.
I think before we're
Yeah.
this and this.
Yep, that's exactly right. So bottom leg's gonna be straight. Let me extend the table out for you. There you go. Good here. And then this arm's gonna go here on your belly. This one goes overhead. Perfect. That okay for you?
Yeah.
All right, so like I said, this one might be a little bit sharp just right when we first do it. Okay. One more breath in. Out. Oof, very tight.
I
Okay.
don't think anything popped.
No. Let's try one more time here, okay? Bring that bottom hip forward a little bit. There you go. A little bit too much right there. Okay. Try it a little bit different. Okay, breathe in. Out. Yeah, tough. Let's try the other side. That hip is stuck, brother.
Yeah, it is.
Okay. Breathe in and out. Good.
Yeah,
There we
I
go.
felt that one.
Definitely got it there. Let's try it one more time on this side, and if not, there's something we can do with the table that will help. So. Oh. Yeah. Not fun to lay on. Okay, bottom leg straight. Good. Let's try this just a little bit different. Okay. There it is. Woo! That was a tough sucker.
Yeah, it was.
Okay. Perfect. Let's have you scoot up just a little bit. We're going to decompress the neck just a little bit. So lift that head up for me. Good. Set it down. Do you have any pain if I go there, or does that feel okay?
I feel it down here.
A little bit in your back?
Yeah.
Okay. Painful or?
A little sharp, yeah.
A little sharpness. Okay. Maybe we'll avoid this one then.
Maybe what?
I said we won't do that one then. I don't want to flare your back up. So we'll come back to that one, decompress you once we're not as sensitive down there.
Okay.
So let's do this. Let's stand you up. Let's see how everything feels. We'll look at some of those movements again. So let's have you go this way. You reach down, touch your toes. Good. Bend backwards. Don't be a hero. Okay. And now how's that feel compared to before?
It feels better now, but
Yeah.
it just, now I feel it down here.
A little bit of that.
Just even standing.
Yeah. So we got that to move pretty well, but we did have to slam on you 3 times. So you might be a little bit sore from that.
Okay.
But after the soreness from getting that to move fades away, then you should feel much better.
Okay.
Your hips weren't too crazy, like out of alignment. I don't think your like legs are longer than the other or anything like that. And how's the neck and mid-back feel?
That's fine.
Good. All right.
You do any shoulder blade workage or poppage or?
Yeah, so when we had you face up and had the arms crossed, we got the thoracic spine between the shoulders. We can
Okay.
give a kind of second look at that. So go ahead, go face down.
I'm just saying, you can pop wherever you feel like.
Yeah. Go ahead, go face down. I think we got most of it, but let's just take a look. Let's try this. I'm gonna give your head a little turn, keep everything nice and loose. Yeah. I think we got this from face up. Yeah. Okay. Let me give you a little bit of massage gun here to calm that down. But we got all this area with the ribs and the mid-back between the shoulder blades pretty successfully from face up. Yeah. Okay, let's see how that feels once you're on your feet. You can do your toe touch again if you want. You can just kind of move around, explore. How's that feel? A little better?
Yeah.
Good. Okay, so overall, what do you think of your first experience?
Yeah. Quick and keeps all the parts that I can't pop anymore.
Yeah.
The
Getting there.
neck one was really good.
Yeah, and that opened up really well for us. So we'll kind of
hopefully I just won't do it myself because just
yeah.
when I'm in front of my
Yeah, there's not anything like inherently wrong about doing it yourself. It just, if you're one of those people who sometimes you feel worse after you do it, then you should probably try and avoid it. But
Yeah.
I always tell patients, if you pop yourself all the time, you never feel worse afterwards, then it's not really that big of a deal. You can kind of get away with it. But some people, they pop themselves and it might even be 50% of the time that they feel worse. And for
Yeah, I
them,
feel worse.
it's like you definitely don't want to do that. So Okay, well, you don't have anything too crazy going on. What I'd probably recommend for you is something like twice a month for a little while. And then after a little bit, we'll taper you down to something like once a month, once you basically stop feeling this stiffness and stuff from standing all day.
Yeah. The back is what I really want to focus on, the lower back.
Yeah. So I think if we come back in about 2 weeks and hit that again, you'll be doing good. I mean, we could start you at once a week, but I don't think that you need to come in that frequently. I think you're going to be okay with like every other week. And we'll do that for maybe 2 months, maybe 3 months if it takes a while to respond. And then assuming that you respond the way I think you're going to, it won't be long before we can taper you down to less frequent visits.
Okay.
So that's our kind of good plan there going forward. I think twice a month for a couple of months.